Prisons are feared not to being very healthy places. In fact, many diseases including communicable diseases like HIV, hepatitis B and C, syphilis, gonorrhea and tuberculosis are frequently transmitted among prisoners. There is also a high prevalence of mental health problems, and mark you, this is not only on prisoners but also prison officers. So how do we ensure that prisons are not becoming breeding places for diseases, especially now in the COVID era? Another vulnerable group is people with disabilities. How are they coping? About 2.2% of the Kenyan population, or 0.9 million people, live with some forms of disability based on the 2019 census. What really has been done to offer extra assistance to this group amid the pandemic? Persons with disabilities are grappling with income losses amid COVID-19 restrictions that include lockdowns, curfews, among others. We'll be speaking to the relevant stakeholders to dig deeper and unravel what is really happening. When the announcement was made to have all doors closed to help curb the spread of the deadly coronavirus, those in prisons will be assumed safe. However, over time, cases began being recorded behind the bars, with isolation facilities being created in these highly congested areas. Our reporter Shilling Atich breaks down the state of the health of the people behind bars.
Close to 11 million prisoners worldwide, as well as the officers who are charged with ensuring their safe, secure and humane custody, are affected by the COVID-19 pandemic. By definition, prisoners live, work, eat and often sleep in close proximity within strictly restricted areas. However, COVID-19 prevention and control measures alone has proved insufficient for many prison systems plagued by overcrowding. Data from the Kenya Prison Service shows an estimated 42,596 people are incarcerated in Kenya. The prison's population rate as of 2020 stood at 81%. The report further shows that there were 129 prisons and remand facilities operating in the country, which evidently shows that the prisons and remand facilities are overcrowded. The environment, therefore, not allowing for social distancing. With the spread of COVID-19 in prisons, the Kenya Prison Service released up to 14,000 prisoners and remandees in the effort of decongesting the prisons. 48 men's, women's and juvenile prisons have been reached with the effort, which includes setting up hand-washing stations, providing soap and disinfectant gel, as well as health education to inmates about how COVID-19 is spread. Prison staff have been trained in COVID-19 prevention, symptoms and what to do if someone falls ill. On the flip side, the cramped accommodation areas, poor hygiene, ventilation and nutrition, as well as insufficient healthcare services in many prison systems undermine infection control measures and thus significantly increasing the risk for infection amplification and spread of COVID-19. That's the Prison's Health Watch. I am Shilling Atich.
We are now joined by Peter Kiama, a governance, a human rights and organizational development specialist, and also the executive director, Featured Independent Medical Legal Unit. Thank you for creating time, Peter. Peter, how does the Independent Medical Legal Unit work in relation to prisons?
When it comes to prisons, the work we do as the Independent Medical Legal Unit is linked to the Kenya Prisons Service, because the issue of human rights protection is critical even for those who are in custody within the criminal justice system. And one of the key pillars of our work is to ensure there are adequate reforms within the criminal justice system to ensure that whoever you are in society, your rights and freedoms are guaranteed, unless where the law says that they'll be limited.
Peter, you've been working closely with prisons, and it goes without saying they've also been affected greatly by COVID-19. What's the current health situation like in prisons?
As you have observed correctly, the issue of mental health or psychological well-being has, been thrown to the center of our existence. partly because of the anxieties that have emerged from this pandemic. People being anxious of their own health, people being anxious of the health of others. And so it has equally applied to those in prison, either in custody, in remand, or who have been sentenced to serve a term. We were able to partner with the prison service to provide virtual psychosocial sessions to prisoners in one main prison facility. This is Kisumu Maximum Prison, which we used to formerly call Kondele Prison, which has 3 facilities in one, the maximum and the minimum, and also the women's section. So through our support, we were able to provide support to a total of 90 prisoners within that prison, both men and women, 60 men and 30 women in that prison. We were also able to train prison officers on how to take care of the prisoners during COVID-19 in terms of preventing mental trauma, but also being able to address that trauma when it arises among the prisoners. We were able to also train officers on how to provide psychosocial support, but also the prisoners themselves. We were able to train a few to provide peer counseling to some of their colleagues.
Has the government put in place adequate measures to enhance better hygiene and sanitation in prisons, maybe to help combat the spread of COVID-19 and other diseases?
Yes, I would say, I think that's just an appeal to the government that because COVID-19 is the new normal, that there will be a need to revisit the support to the prison system. Why? Because whereas before COVID, relatives would visit and complement or supplement what the government was providing, you do find that the fact that the relatives have been cut off from visiting prisons denies prisoners that supplementary support. And therefore, the government would need to look at that and see how does the government provide, for example, more supplies to prisoners, but also the whole psychosocial support that is not currently there is needed, and that requires extra budgetary support.
Thank you so much, Rita Kiame, Governance, Human Rights and Organization Development Specialist, and also the Executive Director, Featured Independent Medical Legal Unit in Kenya. Thank you for creating time, Peter. We are now joined by Leila Semkiwa, a psychologist at the Kenya Red Cross Society Mombasa branch. The Kenya Red Cross has been able to provide different humanitarian aid to different prisons. And to quickly engage Leila, what sensitization forums on enhancing COVID-19 awareness in prisons have you been able to have, and what impact have they had so far?
Under the prison interventions, I think Kenya Red Cross Society has been able to conduct a lot of sensitizations to the prisons and some inmates on COVID-19 and IPC measures, that is the COVID-19 infection prevention control measures. We've also been able to conduct a lot of awareness on mental health. We've supported the prison officers with debriefing sessions. Those are group counseling sessions whereby we get prison officers once a week, around 15 to 20 prison officers. Once a week, we have counselors who conduct those debriefing sessions.
Since you have been speaking to the staff and the prison wardens, what do they describe the situation in prisons like in terms of mental health?
In terms of mental health, the situation is very worrying, and we have noted that there's a great need to continue with the prison interventions targeting mental health specifically. We see that there's a lot of fear and anxiety coming from both inmates and prison officers, which has been greatly caused by the lack of knowledge maybe on COVID, and then there's a lot of mental health distress from both prisoners and the officers. There's a lot of what would we call denial. There's a lot of work-related stress. Now we see that during COVID, the officers do not get to go for their periodic leaves because of the IPC measures. You really have to like work. The workload has greatly increased because you cannot go for leave now. So there's a lot of burnout coming in from the prison officers, a lot of fatigue, there's a lot of marital conflict, and I'd say generally work-related stress. Not forgetting the drug addiction.
Leila, how worrying is worry? You say that the status is worrying, but how worrying is it? Can you please describe that for us?
We do have mental health cases among the inmates in the prison facilities, and there's little to no access to psychological services for them. So, and we also see that mostly for the prisons, it's national governments and Red Cross that comes in to support the prison facilities. So we'd really urge for other partners to also come in and support the prison facilities.
Leila Semkiwe, a psychologist at the Kenya Red Cross Society Mombasa branch, and also for the good work you're doing to sensitize prison officers, staff and inmates. As we are not out of the woods yet, we take a quick short commercial break, and when we get back, we'll be tackling the conversation on the impact of COVID-19 on vulnerable groups, especially those living with disabilities. Stay tuned. Have you ever thought of how people with disabilities have been coping with the COVID-19 pandemic? For instance, it's a challenge for some visually impaired persons to adapt to some of the government directives put up to help curb the spread of COVID-19. On the same breath, what has been done in regards to this community? Today, we wear their shoes and hear some of the testimonials from different parts of the country.
Mara nyingi hata usaidizi ukija utufikii. Kwa hivyo ningesema kama ingewezekana tuwe tukifikiriwa juu. Sisi hata makeses tukiwa nayo haitambuliki.
Kuna hii issue ambao government walisema kwamba you work from home. Sasa yule mtu anauza peremende pale, yule mtu ambaye anashona viatu pale, yule mama ambaye anashona nguo ndio watu waweze kuja kununua, hata certain place huwa ilikuwa inawapatia shida nyingi sana. Kwa hivyo walemavu wamepata shida sana wakati wa corona. Manake ukiangalia kwa hizi vitu ambazo tunapewa za kuosha mkono, saa zote ziko juu sana na mpaka mtu ainame chini. Sasa mimi niko na elbow crutches. Hebu naambie nitainama chini saa ngapi na nitashika hii mfereji saa ngapi. Yule asiyeona hajui mahali paka ile kitu iko ambayo anaweza kuweka mkono wake mpaka kuwe kuna mtu ambaye atamguide. Alafu pia kuna hii kitu inaitwa accessibility on language. Wengi wetu hatujui sign language. Kwa hivyo hata deaf, yule hearing impaired akija kwako ofisini inakuwa ni changamoto.
In studio, we have Julius Mbura, an advocate for disability rights. He works for an organization known as Enable. Their aim is to empower visually impaired persons to adopt the use of assistive technology. Julius describes himself as a blind lawyer with a passion for automotives. Julius, thank you for creating time. I know because I have covered your story,
yes,
especially on your love for cars. But viewers back at home who might not have heard about Julius Mbura and his love for cars, a blind advocate, can you describe what you do?
So I'm an advocate for disability rights, and I'm the advocacy officer at Enable, where I get to structure out and also design ways of advocating for disability rights and also empowering blind and visually impaired on using assistive technology. I also have a big passion for cars. That goes into my childhood where I discovered that my love for cars is bigger than, you know, my lack of sight even. And Julio Supercharge is where I review cars by touch and feel. So I bring people into another dimension, showing them that the love for cars doesn't need to be visual. It can also be sensory. So you appreciate cars through touch and feel. And also you can immerse, like I immerse a lot of information, and I actually give people the dimension of a different angle of what they think of a car or what they think is being a car enthusiast.
Julius,
Yeah.
Enable organization.
Yeah.
You spoke of assistive technology.
Yeah.
What is assistive technology?
Assistive technology is using devices that have a sort of accommodation into them, like having a software like a screen reader on computers that can actually read over whatever you're trying to do or type. And then like my phone, I can use it independently because it has voiceover, which is in a way a screen reader also. So it enables me to use my phone autonomously because I can text, call, and actually get into different websites.
How many people have you reached so far with Enable organization?
We are talking about schools for the blind, which are 6 in Kenya, and also partners even outside Kenya. So the impact is bigger than you can put in a scale because we reach people who also impact other people through our, you know, motivation and empowerment. And that one goes a long way because once you've impacted like 5 people in a community, it takes them another like 20 people to also even shift perception of what people think about disability. And now we are expanding, we are scaling up to actually accommodate all sorts of disability. But Enable started with blind and visually impaired, but it's us to take it to the next level because disability is in many ways and forms.
COVID-19, has this pandemic affected your livelihood?
Very much.
How?
To start with, I use touch and feel to actually get around and also to do my daily activities. The pandemic came with the restriction of not touching surfaces because you can contract the virus. And this one put a hindrance into even how I use my money. So going into even transportation, using public services, it's not safe for someone who's blind because you don't know where you're touching, you don't know which kind of people you're coming into contact with. Also using money, that one is a big problem. So I had to resort to using mobile money like M-Pesa for my safety. And also sometimes you get that you are putting on a mask, you're putting it the wrong way because you can't like touch colors. And then in so many ways, people were taken to online. Everything went online, being encouraged to use online platforms and even banking services. Most of these apps and websites, they are not accessible to people, especially I would say for blind and visually impaired. So the developers of different apps, they develop these apps and websites without having people with disabilities in mind. So we are mostly an afterthought. So after creating the platform, they now think of, oh, we might get 1 or 2 people who are persons with disabilities, so we need to accommodate them. So I say instead of building bridges to include, like for inclusivity, let us try accommodate from the word go. Let us try build ramps instead of bridges at the end.
Accommodate all these things, you know, these are policies when it comes to the government. Has the government been able to include persons living with disabilities in their response to combating COVID-19?
I would say in a wide shot, it hasn't been accommodating persons with disabilities because even in dissemination of information about measures and also protocols that are supposed to be followed, they don't normally include people with disabilities. It comes afterwards.
Still an afterthought.
Yeah, it's an afterthought. Because even like when you're telling someone to off on their elbow. For the blind people, we normally hold our guides on the elbow. So you see that like there is, I would say, disparity of what they think is getting information out there, and also trying to include everyone in actually getting that kind of information, because some of the disabilities are very sensitive, like the mentally disabled people, and you need to like adjust the information for them to get what you're saying, like to put on mask and also to keep social distance. And you see, for a blind person, you need to be closer to your guide for you to maneuver. So it's kind of, I would say, it hasn't been an easy road, and we've tried to get at par with everyone else, but it's been a struggle for persons with disabilities to actually be in the same conversation of, being safe with everyone
on policies,
else.
what should the government do?
I think the government should include and also partner with organizations that are trying to advocate for disability rights to actually have the stakeholder pool widened, so that these people can give them the directives and also give them the ways that they are supposed to follow to actually bring inclusivity, because it doesn't just go as far as just saying that we are trying to accommodate people with disabilities. It goes far into what have you put in place to actually implement all this, because there's a huge disparity of the policies that are on the ground, and the laws and the implementation of those particular clauses.
Thank you so much, Julius Mbura, for creating time and that amazing narration of your story.
Yeah, I appreciate so much being here.
Thank you.
Thank you.
And with that, we come to the end of the show. And as always, see you next week, and remember to stay safe.